The following segment is sponsored by Oakview-Medical-Associates.
Whatever back to school means for your family, you certainly want to keep your child healthy this school year. Dr. Nita Bajor from Oakview Medical Associates is with us today. Hi, Dr. Nita.
Hey, how are you, Margaret?
Great to see you. I know you have patients who are asking a lot of questions, whether their kids are learning in person, online, a hybrid of both. Exposure to illness is a big concern. What are you generally telling them?
Well, now with a lot of awareness, we're seeing a lot of patients, their parents calling about how can I make sure they don't get sick? And one of the main philosophies we always hold as primary care physicians is prevention is better than cure. And hand washing, is one of the main, main actions that we should incorporate. We all do that. We all use hand sanitizer, but now even more important as we go into the flu season. And there are a couple of steps that make it easy, and especially with kids, make it really easy for them to remember. One would be what we call, it's like a 5-step process. So I'll just go through that with you. One would be just wetting your hands under running water and then lathering it, scrubbing your hands together till it actually bubbles up, and then rinsing off under running water and then drying your hands. So that process usually should take about 20 seconds, and that's what's recommended to really wash off germs. Also, if you have rings, other items on your hand, make sure that you wash through those as well thoroughly.
Okay, so really getting our kids used to that routine is important. I know another big thing is the eating well, the nutrition. That's a major tenet of lifestyle medicine as well. Talk to us about healthy eating helps us to fight off viruses, and what recommendations you have for your patients.
I think eating a nutritious, well-balanced diet goes hand in hand with prevention. Making it easy for your kids. What I recommend is just having your children just list their top favorite items that they would like to eat during the week. And as parents, just prepping that food a little in advance on the weekend, maybe having one meal night per child so they're involved in it. It makes it fun for them. Also giving them a rainbow of vegetables, making sure they get colored veggies. If you have a child that's a little picky, maybe you can try a different style of cooking that vegetable. I know some kids may not like boiled vegetables, but the minute you grill them, you involve them in the outdoor cooking experience, they just love it. And I have, my children also are like, oh my gosh, I can't believe that's mushroom. How did I eat that? So that makes it fun. Going back to the hand washing, hand washing really has prevented 1 in 3 diarrheal illnesses and 1 in 5 respiratory illnesses. And it must be done before, during, and after prepping the food as well. Also, before you eat food, after you eat food. And then if you decide to use hand sanitizer or you don't have running water available, make sure you use a hand sanitizer that has at least 60% alcohol. The way to do that is to apply a good amount, make sure you rub your hands and apply it all within the different web spaces, and then dry off your hands before you touch any surface, because otherwise it's not effective.
Okay, well, we know, so good hand sanitizing, nutrition are big factors, and we're going to look at some other factors, some other pieces of advice coming up next week. But before we go, let's talk about Oakview Medical Associates. Tell us what makes your practice special and about your approach to treating patients.
Oakview Medical Associates is a practice I founded in 2008 with the simple philosophy of really teaching or treating a patient one step at a time, really personalized healthcare approach. As a provider, as a physician, it's my responsibility to make sure each patient understands what's going on with their health, when it's not on track, if there's any blood work that needs attention. And really, I love shared clinical decision making, which means I involve the patient in the process. The patient's in the driver's seat, and I give them information, whether it's medication, whether it's a lifestyle choice, to really help them feel empowered that they're in charge of their health. Nowadays, with the pandemic, I think the real pandemic is people are neglecting their health, not coming in for doctor's appointments. So we've evolved in our practice to make it really easy. We do telemedicine. I mean, you can even send us a text on our Oakview Facebook page, and we will get you in, with some basic information. We can do video calls, audio visits, and just kind of make it easy. We even have some elderly patients that are still afraid of coming into the office. We'll see them in our parking lot, curbside, do whatever needs to be done, draw the blood there. I mean, I have a great team. I'm really blessed that everyone has come together with 3 providers, and we really recognize the importance of meeting the patient where they are, so to speak, literally now, whether it's the
Yeah.
parking lot or in the comfort of their home, we're adapting to their needs. So it's really been fun. We see people of all ages, and we see a variety of conditions. We treat, chronic ailments like diabetes, high blood pressure, obesity is a big one that we're always paying close attention to. We also do annual physical visits, which is a time to do your blood work, make sure we screen you for any family history of cancers, any genetic things that we have to pay attention to. So it's really a fun environment. We want you to feel empowered with your health. And, sickness shouldn't be something that we are fearful of. It should be something that we learn to manage, get out of, and go to a path of wellness. So that's been always my philosophy in healthcare.
Well, Dr. Nita, we hear from your patients all the time. They all love you. They love working with you. And anybody who wants to get in contact with you, Oakview Medical Associates is located 11 Five Forks Plaza Court in Simpsonville. The number 627-0444. Dr. Nita of Oakview Medical Associates, thanks so much for being with us.
Thank you, Margaret. Have a great day.